My name is Sharon Aldridge and I'm a Programme Manager from the Queen's Nursing Institute. The Q&I saw the opportunity to get involved with this charter as something that they would like to be involved in, because the Q&I are a charity that support nurses and patients and relatives and also employers and educators in looking after patients in their own home. They'd see patients living in care homes as people living in their own homes, and so therefore see this as a vital part of our activity. We particularly were interested in the collaborative approach to developing this charter, because it was really good to be involved with lots of different practitioners all coming together to develop a really important charter that outlines very clearly the care of patients with swallowing difficulties in a care home setting, and in particular around medicines management. The aspect of the charter that I had input into was around the role of the registered nurse in the care home setting, and in particular to ensure that they had the right knowledge and assessment skills in relation to medication management, that they were utilising a patient-centred approach, and that they had knowledge of mental capacity, and especially in relation to covert medicines administration and a practice that no longer exists around that. The development of this charter fits in particularly well with current thinking and regulators of care in care homes, because there's a recent Care Quality Commission report that talks about care homes in particular, and whilst it talked about 70% of all care homes as good, where poor quality care was actually discussed, it talked about it in relation to medicines management and the unsafe practice around medicines management. It also talked about time and nurses being allowed to have the amount of time that they need to administer medication to patients that have swallowing difficulties. So I'm particularly passionate about this charter because I think it's collaborative in the way that it's been put together, and it's really good to hear from lots of different professionals all trying to put together a document that's like a go-to document also in practice for both patients and nurses and healthcare professionals alike.